Imagine you find yourself in a situation where you no longer enjoy the things that you used to enjoy. For example, you may have enjoyed going to work, in your office, in your garden, but now you don't. You may have enjoyed spending time with friends and family, but now you don't. You want to stay by yourself, locked up in your house. You start to lose sleep. You find difficulty in concentrating on your work, and you feel tired before getting any work done. If you find yourself in this situation, you have signs and symptoms of depression. And without timely evaluation and appropriate interventions, these symptoms intensify. And when they do intensify, you become unproductive at work, at home, and in your community. And when this happens, you will feel useless, worthless, and hopeless. And when you lose hope, you see no need to take care of yourself. You see no need to take care of your family, of your children. In the worst case scenario, you will resort to using excessive alcohol or drugs, or you may end up taking your own life. In my doctoral research, I found that 1 in 3 persons with HIV/AIDS have significant depression symptoms that interfere with their ability to take antiretroviral medications. So, to address this great need, my colleagues and I at Makerere University, with support from Grand Challenges Canada, we developed a group support intervention, which was to be used as a first-line treatment for depression among persons with HIV/AIDS in poor resource areas. This intervention treats depression by enhancing emotional support, positive coping skills, and income-generating abilities. We evaluated this intervention in a randomized controlled trial in which we compared it with an active comparison, group HIV education. And the results were published in the Lancet HIV journal. 6 months after the end of the intervention, we found that 80% of the group support participants, compared to 50% of those in the control group, strongly agreed that the intervention had reduced their depression symptoms and motivated them to make positive changes in their lives. The women in this support group reported that they felt empowered and had more control of their emotions, and they spoke of giving better care to their children. Others said that sharing their personal painful experiences with others changed something in their lives. For example, that lady, she used to lock herself in her house, annoyed and unhappy, but now she finds herself sharing her meals with other people, something she used not to do. Men who had no income got together in a group and started a project of growing vegetables for sale. Others who used to drown themselves in alcohol now report that they may only take 1 bottle of beer in a week, and sometimes they may take 2 weeks without tasting any alcohol. A man who could not pay school fees for his children prior to this intervention now reports that school fees is not a problem for him. And he also reports that the relationship with his wife improved. It is very clear from these results that the addition of the group support intervention to the antiretroviral medication gave these patients a new lease on life. Their mental capacity was enhanced, and this resulted in better health, social and economic outcomes. I know that I made a difference in these people's lives. And for this work, I received the 2016 Elsevier Award Foundation. Elsevier Foundation Award. So my take-home message for you is that group support interventions for depression are just as important as the antiretroviral medications the patients have to take. However, the burden of depression in resource-poor areas, like most of sub-Saharan Africa, the burden is too great. The delivery of these interventions cannot be done by mental health workers alone. You too can make a difference in these people's lives. If you can add your support to that of Grand Challenges Canada, MQ Transforming Mental Health, the two funding agencies that are now supporting the training of other health workers in HIV care to also learn to recognize depression and treat it with a group support intervention. I would like to acknowledge the support of my wonderful family, and I thank you for your attention.